So good morning, everybody, and we have, as of today, 9,500 cases of COVID-19 in Albany County. We have a total increase of 226 positive cases overnight. That's the highest we've been now since the beginning of this 9 months ago, since the outbreak started. A day before, we saw an increase of 221. The day before that was 161 due to the snowstorm, and I was hoping because of being shut down on Thursday and with Friday that our numbers would be lower. And unfortunately, we did get a day or two like that, but it's unfortunately we have 226 positive cases today. So there are currently 2,990 people under mandatory quarantine. Of the new cases today, we know 12 had close contact with positive cases, 5 were healthcare workers, and 209 don't have a clear source of infection at this time. And like I've said before, give us time. Dr. Whalen and her team are working around the clock, and these are big numbers that we're dealing with. So it's going to take time. Be patient. I know people have called me that I know, hey, I'm positive. Somebody hasn't called me. I go, well, when'd you get results? And they go, a couple hours ago. I go, give us some time. We'll get to you. It's going to take time. It's going to take time. Please be patient. You want to help us out? Write down who you had contact with, where you're at. All these questions, they're going to inquire when they call you and help them do their job so it's quicker. So people out there that are positive, please, these are things you can do to be proactive in this situation. Over the last 5 days, we've had 201.2 new positive cases. So yesterday it was 200.4, so we slightly went down. As of today, 32,151 people now have completed quarantine, which is awesome. Of those, 7,929 tested positive for the virus and have recovered, which is also good news. So I do want to point out some of the questions we get on Facebook. We do put out the recoveries. There are a lot more people recovering, which is awesome. But unfortunately, we have people that are, passing away from COVID-19. So yes, we do put the recoveries out with everything else because it is good news. But unfortunately, we are seeing more people in the hospital, more people in the ICU this time go around. So yeah, please, people, just do your homework, look at the stuff we put out, and we try to make it as clear as we can. Since yesterday, we had 250 people recovered since yesterday. And unfortunately, this seems to be the average in this neighborhood. There was 11 new hospitalizations overnight. So we end up being between 10 and 15 new hospitalizations. People come, people go, but there are now currently 107 people currently hospitalized from the virus. Yesterday it was 113, and the day before that was 114, which was the peak. So hopefully we're seeing the continued trend of going downwards, which that's, obviously I don't want to see our residents in the hospital. I don't want to see anyone in the hospital. Unfortunately, 23 patients are currently in the ICU, which is another record that we've never seen before. Yesterday it was 21. The day before that was 21. So we're seeing more people in the ICU. So I want to remind people, I know the holidays here. I know Christmas is on Friday. I know people are going to travel. Please stay home. I know the governor, Cuomo, doesn't want to shut down. We don't want to shut down. But the reality is this. I'm glad that schools are remote. I'm glad that the Christmas break is here. But parents, please don't intermix your kids. Watch what you're doing when you're socializing. And with the holiday, I want you to enjoy it. I want you to be around the people you're always around. And if you're not around certain people, please stay 6 feet apart, wear your mask, cough into your arm, clean your hands, and do the right thing, and we'll get through this. The vaccines here, and Dr. Whalen can talk about that more, it's going to take time. It's going to take time to get out to everybody. It's going to take time. So please be patient. So we continue to monitor the Capital Region's hospital capacity. Our hospital bed space has been stable at roughly 25%, same as yesterday, while our ICU bed space is now down to 27%, which was 46% at the beginning of this month. So our ICU beds are really trending down. We have a 1,400 call today on our control room with Dr. Venditti, and he's going to talk about how they plan on shipping people around if it gets to that place where they start having a problem with bed space and other things. So So as we get that information today, we'll get it out either later on today or first thing tomorrow morning. So please be patient. We continue to urge people, again, to wear your mask, socially distance, do the right thing, and we'll get through it. I know it's hard, especially ahead of the holidays, but again, I know I got a lot of feedback. I'm not advocating a shutdown. What I'm advocating is a slowdown. Private companies that are downtown Albany that don't need to be here, don't be here. Work remote. The companies that learned how to do things remotely, please go back to that. I know people are out doing the last minute Christmas shopping. If you don't feel comfortable, don't go in there. If they're not socially distancing and not doing the right thing, and I know most stores, they're trying. They really are. They got the footprints out in front of the store, 6 feet apart. They're trying to do the right thing. Order online. Most of the stores now have websites. They have availability where you can support the little businesses here on Lark Street, all around the city of Albany, downtown Albany, Cohoes, Waterville, Green Island, Colony, Bethlehem. They have these little stores now that you don't have to go into. You can call ahead, you can pick up, they'll leave it outside. You can shop online, and that's what I'm encouraging people to do. Please help us get through it, because obviously there's a new strand of this. We talked about it yesterday. The governor has said it time and time again. And now we just got a vaccine, and it's going to take time. It's going to take time. So please work with us and before we continue. I just want to remind people the schedule is a little bit different with the Times Union Center and other things. So please go to our website and look at the hours being adjusted, especially with Christmas on Friday and Christmas Eve. Pay attention to that, and if you need to get your kids shots, they have the different numbers, and again, we'll continue to get through it as we work together. Some of the other things, I know we'll put a list out of the priorities. There's 5 phases of where you fall in that category to get the shot. I know that's been the $1 million question. I've heard from a lot of people that want to get there. They want to take the shot to show people. I'm not going to call them out. I'll just say this: there's a priority list. We have to follow the list. And Dr. Whalen can talk about it better than I can, that there's people that are priorities, like our nursing home staff, our residents, our EMS workers, our hospital workers, our doctor's offices, you've seen the next phase. It's going to go to coroners. It's going to go to the people that actually have to, funeral parlors that have to work out in the public, that have a high risk of being exposed. So you'll fall in there. Just be patient. I'm glad they're eager to get the shot, but just be patient. Your time will come, and you'll get it when your time comes. And again, if we get more vaccine quicker and more supplies, I know the governor is going to get it out through the hubs and get it out there to everyone quicker. Just be patient. But Dr. Whalen.
Good morning. So as the county executive indicated, we continue to see high numbers of cases. And today, again, unfortunately, we set another record. I would encourage, as I've said before, all county residents to visit our website and get information. We do have staff working 7 days a week to reach out to cases that have been identified, but if you get a call that you have had a positive result, and you are waiting for that call from the health department, it would serve you to go on the website and educate yourself. We have tools including what you need to know about isolation, the isolation order, what you need to know about quarantine, and even how you can start to prepare the list of contacts for quarantine. So all of that information is very helpful for people while they're waiting for the call and to contact those that they may have been in contact with. It is Christmas week, and we do continue to stress the importance of avoiding large gatherings. We did see an additional surge after Thanksgiving. I think everybody is in agreement on that at this point. And what we don't want is for our numbers to go up even higher. The hospitalizations remain something that we're closely monitoring, and we don't want to get to a place where we're seeing other places in the country where we are seeing surge. We're starting, in addition, to see small numbers of flu cases. I understand that a lot of people don't understand that flu is different from COVID. They are completely different viruses. They have different tests. They are not the same disease. But we know flu at this time of year continues to be a problem that a lot of people struggle with. We do have a flu shot that's available, and again, I encourage people to get a flu shot now if they haven't already done so. It does take about 2 weeks after you get the shot to have immunity, but the behaviors are the most important at this point. As the county executive indicated, we are starting to see vaccine rollout. Now we have Moderna vaccine coming into the capital region in addition to the Pfizer vaccine. As I indicated the last time I was here, the governor has made a decision for all the vaccine to come through the regional hubs, of which there are 10 in New York State. Our regional hub is Albany Medical Center, and I'm happy to say that Albany Medical Center is working with the local health departments on vaccination strategies. This I've shared before is something that we at the local health department have planned for years. So our planning is something that we're happy to share with the regional hub and create a partnership moving forward to assist in any way that we can with those very important efforts to vaccinate. Right now, we know that vaccination of hospital workers continues, and we know that there is the additional rollout of vaccination of the 1A population, which includes hospital workers, it includes nursing home workers, it includes first responders in medical roles such as emergency medical service providers, medical examiners and coroners, funeral workers, and persons living and working in long-term care facilities, and long-term congregate settings overseen by OPWDD, OMH, and OASIS. So all of that planning is going on. We know Phase B will include 1B will include other essential workers, and Phase 1C will include adults with high-risk medical conditions and people over 65 years of age not already vaccinated in the earlier phases. That's the information that we have thus far. We are currently in 1A strategy, and we know that we are looking to the national authorities at CDC and FDA to look to other vaccinations that are waiting in the wings. We hope that the supply is going to continue so that we can roll these vaccinations out, or these vaccinations can be rolled out in the community so that we get a good level of people that are taking the vaccine. At this point, there are 2 vaccines 21 days apart. That is both for the Pfizer and the Moderna. The Pfizer, as you know, requires very specific storage, and the Moderna is a little bit easier to get to people, whereas Pfizer, you have to bring people to the vaccine. So right now, that is what is going on in the capital region, and we continue and look forward to this planning process with the regional hubs and with other local health departments. There are 8 of us that are currently working together to assist the regional hubs in any way we can. It is, again, as it always has been, incumbent on all of us to remember the importance of our own personal behavior, which is the single most important factor right now in controlling the spread within the community. So as always, I encourage people to continue to wear masks, to continue to avoid travel and to avoid large gatherings, and really just look to this year to celebrate with those that are in your immediate household. I know this is difficult. You know, I would like to, usually Christmas Eve at my house, we invite all my family in Albany. There are 10 grandchildren. My brother and sister are local, and my parents are local, and it's a wonderful celebration that we've had every year since we've lived in our house, which is now 21 years. It's not going to happen this year. We're not doing it this year because everybody knows the importance of avoiding this type of gathering. We know we have been listening to epidemiologic evidence that has come out to suggest that gatherings like this are thought to be one of the most important spreaders of COVID. And so we've made the decision to sacrifice this year. It's difficult, but we know that it will hopefully help in some small way, and each of you has a role to play. So please continue to do that. We're getting close to 2021. I know we're all hoping for a better year, it's important not to lose track of the importance of these behaviors as we enter the final home stretch. Thanks.
Thank you, Dr. Whalen. And again, one of the things we are seeing and getting a lot of complaints is kind of like an underground parties going on throughout the county. People now that are just can't go to bars after 10 o'clock, they're gathering at houses and they're not socially distancing, obviously not wearing masks. Is that contributing to it? Probably. So please, people, do the right thing, do the smart thing. Again, we'll get through it, but we have to get the vaccine out to everyone first and foremost, get everyone vaccinated, and then we can continue on. But talking about that, please, if you need an appointment for Whitney Young, the number is 518-465-4771. We cover the cost if you don't have insurance. In Albany, which is totally free, set up by the governor, and many places around the state of New York that are free, 1-888-364-3065. And again, with Price Chopper, CVS, Priority One, a variety of other people I can mention, go to our website, albanycounty.com, and you can see the testing sites and the closures and everything else going on. So please take the time, go on there, see what age group your children fall into if you want to get tested. That's why we set it up. And the wait times, which now are pretty much on time, accurate, I should say. I know with the snowstorm it was a little hiccup and when the high demand that they got. So you got to be patient with that too. But I want to share some pictures with you of the many generous donations that came in for our adoptive family. And again, to everyone who helped us out. And please, I can't thank enough our probation department as they prepared to make the deliveries. Thank you for them doing that. To DCYF and all the employees that were involved with this. Thank you, because it makes a difference in the hearts of kids that otherwise have a tough year anyway. Add this on top of it, and it's more difficult. But again, please, thank you to everyone that made this possible, and to the workers. Also, if you need mental health support, it's available 7 days a week, 8 a.m. to 5 p.m. 518-269-6634, and our 24-hour sexual assault hotline number, 518-447-7716, and New York State Hotline United Way. Again, thank you for all the people doing the right thing and being part of the solution, not part of the problem. Thank you. Again, remember, it's a marathon, not a sprint. The light's at the end of the tunnel. We're almost out of this. Let's stay strong, working together in a partnership to get through it. Wear your masks, cough into your arm, clean your hands 6 feet apart. Thank you. Be safe out there.